Well, welcome everybody to the Fresno County Network of Care informational session. I have here myself, Ileana Oropeza, and my coworker, Marisela Sosa, and we will be going over the network of care that we've established for you as providers who are screening for ACEs. So thank you for joining us. We want to provide a brief introduction on what ACEs is. So ACEs stands for Adverse Childhood Experiences, and the mission of this initiative is to change the lives of people and helping providers understand the importance of screening for ACEs, such as how you're doing now. And it's also to provide opportunities for training for you as providers to respond to ACEs in your patients in a trauma-informed care mitigation, just to reduce toxic stress in your patients. So just a brief background, what is ACEs? So ACEs stands for Adverse Childhood Experiences, and it's a stressful or traumatic experience that happens to you or your patients before the age of 18. And this was identified way back in 1998 by the CDC and Kaiser Permanente in a study that really brought this attention forward to ACEs and the effects of it in your health. So again, ACEs is traumatic experiences before the age of 18, and they have categorized ACEs in three domains under 10 categories. You can see here, the three domains are abuse, neglect, and household dysfunction. Under abuse, a person can experience physical, emotional, or sexual ACEs before the age of 18. A person can experience physical neglect or emotional neglect. And types of household dysfunction experienced by someone before the age of 18 is mental health illness, a relative that is incarcerated, the relative that has experienced substance abuse, seeing their mother treated violently, or being a child of divorce. So it's important to combat all of these stresses as a child into adulthood by adopting stress busters. And that's a lot of our focus here with the network of care, is to help clients adopt mindfulness practices, access mental health care, eat a balanced nutrition, promote quality sleep, physical activity, and just continue to support positive relationships in their lives. And that's what we're going to be helping the clients that you refer to us during this initiative. Another background for you on ACEs in California. So in California, we're seeing here that at least 62% of people that live in California have experienced at least one ACE, and then experiencing 4 or more ACEs is 16% of the population in California. So it is a problem here in terms of experiencing ACEs, and that's why we want to promote this in order to help patients address that. More focused in Fresno County, at least 48% of people have experienced 1 or 3 ACEs, and 46% have experienced it with households with children. So overall, 47% have experienced 1 to 3 ACEs here in Fresno County. So what is the correlation between adverse childhood experiences and the person's health? So what we're seeing in all of these studies is that experiencing ACEs is directly correlated to the health of the person or your patient. So you see here, heart disease. If a person has heart disease, the odds that they've experienced an ACEs of 4 or more ACEs is 2.1. So again, 0 is a baseline. If you have more than 0, that's significant. And as we scroll down here, we see category 6, Alzheimer's or dementia. We see a big rise in the odds of them experiencing 4 or more ACEs to 11.2. If we scroll down to suicide attempts, which is the 10th leading cause of death in the US, we see that it actually jumped significantly to 37.5, the odds of that person experiencing 4 or more ACEs. So definitely ACEs does affect health in the person as adults. So we do want to prevent and treat ACEs in order to prevent the leading causes of death in the US. So what this has developed is, in order for US providers to identify ACEs, is the California Office of the Surgeon General developed tools for you to identify them. And they're in the form of, for children, we call them PEARLs, the pediatric ACEs and related life events screener, and for adults, it's the adult ACEs screener. If you see here, a lot of you might already be screening for them in your clinics. The child tool, it's for ages 0 to 11, and that's completed by the caregiver. And the adolescent tool, it's for children ages 12 to 19. It can be completed by a caregiver. And finally, the adolescent self-report tool for ages 12 to 19 can be completed by the adolescent themselves. And they are available in 17 different languages as well. So the benefits of screening, so by screening for ACEs, you as providers can identify toxic stress, and you can identify the ACE-associated health conditions. As you remember, in the leading causes of death, if the person is suffering from diabetes or mental health illnesses, then you can identify that ACEs might be behind that. You could also target prevention efforts for the patient if you know their ACEs and what they've been suffering from. So treating, for example, if they have no social support, then we could help to increase that for the patient. And then lastly, you really empower the patients in order to help them understand that their experiences before they've age 18 doesn't have to determine their health as adults. So helping them understand that correlation between ACEs and their health can empower them to better improve their mental health and just overall physical health. So what is exactly the network of care that we've established? Well, first of all, we've just launched this network of care. We abbreviated by NoC. So the newly launched network of care is designed to help you, the Central Valley providers who are screening for ACEs, connect patients to trauma-informed services. And the way we connect people to trauma-informed services is to connect them with a dedicated team of community health workers, and we abbreviate them as CHWs. And CHWs provide ongoing case management for the patients with high ACEs score, and they also provide additional education on ACEs and the importance of treating them in order to improve their health. So I'm going to turn it over to Marisela, who will talk a little bit more about the CHW program under the Network of Care grant.
Hello, everybody. I'm Marisela, and I'm the lead community health worker here at the Health Hub at St. Agnes. And just to briefly explain to you who we are, we're a team of community health workers here at St. Agnes, and we're here to work with those individuals that you refer over with comprehensive, we offer comprehensive services to patients and members of the community to address their needs in effort to improve their health. So that's like our priority here. Our goal is to work with the clients that you refer over here, including those most complex patients experiencing challenges affecting their health, such as homelessness, unstable housing, food insecurity, other barriers social needs, such as finding a specialty care. So we're here to help those patients and help them navigate the resources out in the community. Next.
And it's free, correct, Mari?
And oh yes, sorry, it's free. It's completely free service. It's free to the patients. We don't charge or bill insurance, or not, it doesn't cost anything to the providers. It's completely free service.
Okay.
And just to briefly overview, this is our staff. Yvonne Duratorosian is our Vice President of the Community Health and Wellbeing. You met Ileana, she's our coordinator. Then we have Tiara, she's a coordinator for the tobacco prevention program that we have here. And Ileana will go into a little bit more of what she does here. I'm Marisela, I'm the lead community health worker, and I oversee the following community health workers: Kim, Raslene, Maria, and Michaela. And Raslene, Maria, and Michaela are going to be the ones answering to the ACEs referrals that are incoming to the Health Hub, and they're going to be able to connect the patients with the available resources. Next. So our community health workers. Our community health workers are non-clinical staff, and we are focused in understanding the patient's client's needs. Most importantly, to ensure that they are connected to the appropriate resource in the community. We do have our community health workers give updates to whoever referred that patient or client, just to make sure that that they are making progress. And so if they have a follow-up appointment with them, they're able to follow up with them and how it's going. Our community health workers develop trusting relationships. This is very important to us because, for one, it leads us to more uncovered barriers. They're able to open up to us and really say, you know what, this is going on and I do need help. So trusting relationships do take a while, but we do have clients that really open up to us and really tell us what's going on. We provide patient education on understanding their ACEs scores more in depth and kind of tell them what services are available for them to, like Ileana said, help them with those stress busters, as well as making appropriate linkages to the community. We use our Aunt Bertha platform, and it's kind of our social care network that connects people into programs. And those resources can be social services, specialty medical services, behavioral health, transportation. And along with this presentation, Ileana will touch briefly on what is exactly Aunt Bertha or findhelp.org as well. We provide assessment. We use our social determinants of health assessment, that's our social needs. And that gives us a little bit more in depth and ask the patients a little bit more about their, for example, do they have enough food? Do they have enough money to buy food? Do they have transportation? Is it a barrier for them to get to their medical appointments or get their prescriptions? So things like that. So it opens a little bit more of a door for us. And this assessment can be done in person when the referral is given to the CHW, or it could be in their homes because we do home visits as well. It could be in our office. They are welcome to come here in our office and meet with us, or it could be done in the community, like a local Starbucks, at a park. So we're able to meet the clients wherever they want to discuss further. We're able to identify goals and work with them to meet their goals, because ultimately it's their goals, not our goals. We just kind of set the ground and kind of tell them what there is out there and link them through them and give them like little tasks where they could follow up, like homework, like, please follow up with this individual, a Department of Social Services, and we'll follow up in a week and see where you're at. And we won't let go of the client or patient until we have a closed loop. And closed loop is meaning that they're connected with that resource and that they're going to help them and start providing services for them. So that's what a closed loop for us is. And then we're able to close that goal for that client. Okay. Next. So this is a brief overview of our CHW ACEs workflow, how it's gonna work for our ACEs. So for example, the start off would be, they show up to your practice, they're registering, the MA goes over the paperwork, it's their annual. So then they're determined which ACE screening they're gonna give them. So like Ileana said, there's different ones, it's the adult one, the ACE or the pearls. So depending which one. So right here, let's say that we have a patient and the patient is 18 plus. So they're gonna get the ACE screening. So then they fill it out. They'll be able to fill it out unless they have an illiterate problem that they can't read or write. Then they can ask the staff to help them fill it out. So the provider will review the ACE screener once the patient completes it, and they're gonna be able to provide appropriate risk assessment. So they're gonna be able to say, hey, this is what's going on. So then the PCP offers referrals to the hub. Hey, can I refer you to the hub for a follow-up with a community health worker on your score? And so at this point, the client or patient's gonna say, let's say, for example, they say no. Okay, no, I'm not ready to move on forward with the help. Give me some more time, or definitely no. So then the provider is just gonna provide education about how the ACE and the buffering practices and interventions can affect their health as they go, and they'll be able to discuss more with the provider and kind of tell them, hey, you really want to follow up with this community health worker. Here's their contact information. Whenever you're ready, you can make that call. And then the provider will be able to flag it in EHR in case that client comes back, or let's say it's another annual and they come back, they'll be able to follow up with a client on that specific topic if they ever followed up with them or so forth. So then let's say we do have a client that say, yes, I'm ready to move forward. I want the help. I've been struggling with this for quite a while and it is affecting my health. You're right. Like I have heart conditions. I have diabetes. I'm pre-diabetic. So many things. So I'm ready. So then the provider is going to refer the patient or client to the community health worker. And the referral is made, can be made via email, Doc Halo, in person, fax, or through findhelp.org. Providers provides the screener and a warm handoff to the community health worker if available. So then the community health worker will take the time to meet with the client, patient on a one-on-one, introduce itself and the services that we provide here, and then completes the our social needs screener with the client. Like I say, we focus on the social determinants of health. So she's going to be able to complete that and go more in depth to see if there's anything else besides what the ACE score has said to follow up with. So then the CHW enters a social needs screener into Aunt Bertha platform. And that's kind of our platform where we also will do our case management, kind of follow up on the referrals that we have made for this individual and kind of keep track of who has said yes to help the individual, who has said no, who is closed, so all those things. So that's really our platform. So then the CHW meets referrals to community organization through Aunt Bertha platform, like I said, to assist and identify those needs. So then the CHW ensures that the patient and family is matched with an agency that's going to help them for their needs. So this is very important for us. If we have someone that, okay, we refer to Department of Behavioral Health and they're going to be able to help them and they already have an assigned case manager and they have their first appointment. Okay, great. So we're going to close that loop until that individual makes it to their first appointment and we follow up with them and they tell us what happened and what's the next process. But let's say that we don't have a match, that this individual cannot get the help that they need at our local behavioral health office. They need a higher level of care. Then we'll go back in there and kind of search for another organization that can help them and start the process again until we get a closed loop. Okay, next. So these are some examples of our goals, patient goals that we're able to link with. So our health hub is in the middle and our department is called the health hub. I get a lot of questions on like, what does HUB mean? Really, it doesn't have a meaning. It's just a hub because we're a hub full of resources. We have a bunch of brochures here. We collaborate with a lot of organizations that they drop off their brochures on the services that they provide. We also have an on-site computer available to assist those clients that would like to come in here and need assistance with applying with a job, unemployment, CalFresh, any other resources that they want to use the computer for. They're welcome to come in here and with the assistance of a community health worker, they're able to help them with that. Next. So this is just an example of the highest patient social determinants of health that we have seen. Medical referral, we've ran into a lot of clients that they don't have an assigned primary care doctor. So it's our responsibility to work with them closely and kind of say, hey, I found these doctors for you. What do you think? And they can do the research, or we can help them do the research and then connect them with a primary care doctor. Housing, looking for housing, temporary or permanent. Temporary, we work with a lot of room and boards that can help us place them temporary until we get them a permanent housing, like for example, an apartment, we're in search of an apartment, or they're working with the housing authority and is looking for someone that takes Section 8. So we work very closely with them on that. And we go to their appointments, we go, see a potential apartment that we found. So things like that with housing. For specialty care, behavioral health, it's linking them with those services to help them with behavioral health. Sometimes they're so scared or intimidated just to go by themselves. So our community health workers are able to go with them to their appointments and advocate for them to receive these services. Maybe they've gone in the past and they've turned them around. So then they'll be their advocate. Hey, this is the diagnosis, and they take appropriate documentation and advocate for them. Social services, we do help them with, like I said, CalFresh, Medi-Cal, apply to Medi-Cal, apply for in-home supportive services. And then transportation also. Some of our clients come back to the emergency room, whether it be our St. Agnes or any other hospital in this county. And the number one is because they didn't get their prescriptions because they didn't have transportation to the pharmacy. So that's something very important to know if they have reliable transportation, because if they don't, then they're going to miss their appointments. They're not going to, pick up their prescriptions, and they're going to end up back to square one. So those are our highest priorities that we've seen. Okay, next.
And apart from the Health Hub, so we also provide health education, including Courage to Quit, which is our tobacco cessation program. So if you have patients that are smokers and they'd like to quit, you're welcome to refer them to our Courage to Quit program. We also have our 6-week Healthier Living, Healthier You program. And this is for people, mainly for people with chronic conditions, but it really does emphasize the stress busters that I said earlier in terms of promoting quality sleep, meditation, balanced nutrition, physical activity. So this is all about living a healthier life, and patients and clients really enjoy this program. We have our diabetes education and empowerment program. This is for people with diabetes, type 2 diabetes, and it helps them really to understand how to manage their diabetes in an appropriate way. And then finally, we have our diabetes prevention program. This is for people with pre-diabetes who are at risk of developing type 2 diabetes. I'm happy to go over more in detail what each of these programs look like. And again, just to note, all of our services are completely free. We will not bill Medi-Cal, either you or the insurance. This is a free resources for anyone in the community. So if you'd like more information, I'm going to have my information at the end so you can contact me.
Okay, and then the important question is, how do we refer those clients that we have that need additional help? So how to refer, we do accept referrals through our health hub at samc.com, our email, or you can use findhelp.org as well to log in referrals and send them our way. We have our fax number up there is 559-450-5430, where you can fax this referral form that we can make available at the end of the presentation. And if you're interested, you can do it that way. Or you can call a referral at 559-450-7770. And we can also follow up with the clients that way. And just understand that we're just here to help you, to help you with those clients that need that additional support, whether it be a simple connection or they need a more complex. We're just here to make that bridge and that connection. Okay,
so shifting back gears to the network of care, we really want to emphasize the providers that are screening for ACEs. If you're listening to this, you're among the first providers in California to screen for ACEs. So we want to recognize you in terms of becoming a trauma-informed clinic, because it is innovative in terms of what you're doing. Not everyone is screening for this. Just to give you an example, you are among the first. There's only a few select handful of providers that are screening for ACEs within Fresno County. So congratulations. But what we want to do as part of our services is to recognize you. So here are the steps to recognize you as trauma-informed. So the first step is to take the 2-hour training, which you have already done, and also a test because you're currently screening for ACEs and billing. The third step is to refer your clients with a high ACEs score to the network of care. So that's what Mari just explained in terms of how do you send referrals over for people with a high ACEs score that need help. And the fourth step is to be recognized by locally as a trauma-informed champion for your efforts. This is a video I'd like to share with you. It's from the California Surgeon General's office. So give me one sec while I set this up.
As healthcare providers, when we screen for adverse childhood experiences, we can treat toxic stress and prevent the negative health impacts that affect so many Californians. Join the movement. Let's make our state of care ACEs aware. As healthcare providers, when we screen...
All right. So again, this is a message from the California Surgeon General's office, Dr. Nadine Burke-Harris, who's this lead spearhead in this effort. And she really wants to promote this to all the providers in California. And it's taken off slowly but surely. But again, you guys are the innovators here in the Valley. So we want to recognize you in a number of ways. So one of the first ways to become recognized as a trauma-informed champion is that we would create social media incentives for you in terms of promoting you through social media with the Fresno County Department of Public Health and through our own agencies and through your own. So this is an example of an internal champion. Your name would be here. You would be recognized as ACEware certified, and we'd also take in your testimonial. And this would be provided to you at no cost, so you can share with your social media friends, social media colleagues, and just anyone to let them know that you are innovative in these efforts, and we recognize your efforts. Another thing we want to do is just to provide you some incentives, such as pins that your staff can wear saying that they're trauma informed and they're part of the Fresno County network of care. You would also receive an ACEs goodie box starter kit, which would have all of the resources and referral forms that you need to start to send over the referrals, and also just some fun facts in here, fun artifacts in here that you would get. So again, we'd love to share all these resources with you and just go ahead and celebrate your achievements. The last way we'd celebrate your achievement is actually at our diabetes symposium, which happens every fall, and usually around 100 or 200 providers attend this. So during this time, we would officially name you as a trauma-informed provider and provide you with the plaque for you to show or display in your office for your staff and your patients to see. So again, just recognizing all of your efforts in terms of, helping your patients treat their ACEs and referring to them to the network of care for that. So I also wanted to provide you with office hours. So office hours are going to happen starting in August, and they're going to be every Wednesdays from 10 a.m. to 11 a.m. This is really a time for you or your staff to come in and talk to us about any issues you're having, any concerns you're having, or any questions that you have, or even success stories you want to share in terms of how it's going with referring patients to the network of care. Really, it's just come on in, grab your coffee. I'll be in, or Marisela will be in, and we will guide you through any issues that you may have. This is, again, free TA, technical assistance services provided to you for providers that are screening. And I'll share the link with you at the end of the presentation as well. And lastly, some important dates to recognize. You are either in here, July 16th or July 21st, or you're just hearing this recording. So that's the first step in terms of completing the network of care. And then the deadline to join the network of care, you would just send an email to us letting us know that you are interested. And so we would get all of the incentives started and get the referral forms over to you. That would be July 30th of this year, 2021. Again, I mentioned the office hours are going to starting in August up until November, and this is going to be once a week for you to just come in and ask any questions that you have to us. And I also want to emphasize the Find Help training. So as Marisela mentioned, we use Find Help to connect patients to resources, and they could also be used as a tool to track referrals that you are sending from your office to our office. So I do want to provide some training on this platform. This platform, Find Help, is free. And I'll be hosting informational sessions or training sessions August 4th and August 11th. And again, I'll send you guys those Zoom links. And finally, if you accept to be a part of the network of care and start to refer patients, then you would be recognized officially at the Diabetes Symposium sometime in the fall. I'm thinking in November. So important dates, I will follow up with an email about all of these. So any questions that you have, please email myself or Marisela. These are our emails. And again, ACE is aware it's coming to California. It's coming to a clinic near you. And you can be that clinic. You can be those champions to help people heal from their trauma, from their ACEs. And we're here to help you. You're not alone in this. So please just connect with us. There's different ways. Email us. We're always available to answer your questions and support you. Thank you so much for your time. We really appreciate it. And we'll talk to you soon.